We want to welcome you to June's Medical Monday, and want to recognize all the men that came today. And also this back table. Wave your hands, back table. All the marketing people. Yay! So these are the people that get all of our beautiful flyers and the details and have everything ready for Medical Monday. So I want to thank them, and I'm glad that they're joining us today. So we also have a special guest panel, and we have Mark Broeker. Wave your hand, Mark. He's with the Neighborhood Health Center. Doug Macias is with NACO Credit Union. Mayor Dave Snow for the City of Richmond. And Eric Marsh with WCTV, Whitewater Community Television. And our main speaker is someone that we really know and love. Tajuan Stoker, who's the Director of Wellness. We're going to let Tajuan have the floor and his wonderful presentation on men's health. We're really excited to feature men's health. That's been a big push within our hospital system, and he has some data. But my favorite part is the one part that I recognized was just last month for Reid the Side View, we both taped for men's health, and Tajuan had to kind of calm me down because for what number one for men's health is cardiovascular, 2 is cancer, and number 3 is accidental injuries, which I like to call dumb men stuff.
Wow, Sherry.
Clear that up.
Thanks, Sherry. It's a great introduction. I'm happy to be here again in front of this group. Very good group. Nice to see a bunch of men out here coming out to support Men's Health Month. We have a long way to go when it comes to supporting ourselves, men, when it comes to health initiatives and making sure that everybody surrounded around us is healthy. Women been doing it for a long time. They have all kind of groups, all kind of initiatives and everything, but we don't. So this is the only time period that I think we focus on it, without any kind of disruption. It's during Men's Health Month, and during that time period itself, it's still some levels of disruption in there. So one thing that I want to see us get better at is focusing on our health overall, men. Okay, and I'm speaking directly to the men that are in the room, so don't act shy. There's going to be some things that we're going to talk about in this presentation that may make you feel like you want to go run and hide, but it's okay. All right, so because we're all facing this, and some of us may be facing this, some of us may not be facing it. It's just good information and good education for us to understand and learn for the future if it's not happening to you right now, okay? So I'll jump into this. So this first slide talks about where do we stand. I just talked about somewhat of a lack of positive movement when it comes to men's health. I tried my best to find everything I could out there on the internet, my own research within the hospital system for information that shows positive movement and positive steps moving forward for us men. Now there is some out there. We're doing quite a bit. I mean, with Men's Health Month itself, there's a very positive movement moving forward. But again, like I said, there needs to be much more done. Our encouragement is low, so us patting each other on the back, telling each other that we need to look for more health opportunities, encouraging each other to go see the doctor on a normal basis, have a regular physician's visit on a normal basis, exercise, eat healthy, all those different things. We can do a much better job at that. And then, yes, it does take women too to encourage us. Oftentimes it takes my wife to encourage me to do some healthy eating along the way. But with it being my profession, it's a little bit easier for me, but we also have to encourage each other along the way. Oftentimes we don't want to hear the truth either. We'd rather not hear the truth. We'd rather not hear the truth about our health, kind of where our health stands. If we are having some type of issues, we want to try to ignore it in hopes that it will go away, but oftentimes it does not go away. It stands there. And so oftentimes we wait until it gets worse until we act on it, or until something happens, or until we're admitted into a hospital system. Then we act like we want to take action. But the goal is for it not to get to that place. The goal is for us to do the preventative things at first to help us not get to that point. Other piece that's on here is the low level of trust. Depending on your upbringing, depending on where you were brought up at too as well, depending on your family history, oftentimes you can develop a low level of trust for healthcare and wellness itself. All right, so for example, as a child, I grew up in Texas. That's where I'm from originally. I'm in the South, from the South. I didn't come up to the Midwest until I was 18 years old, to the University of Cincinnati. And tell you the number of times I went to the doctor, and I believe that was one time growing up. And so it was just one of those things that in the African American community at that time period, it wasn't anything that was easy for us to do. You know, funds were low, and only one person in the house was covered by insurance, and that was the one that was making the money. So at that time period, you know, that wasn't for us. A good thing, and that I had a great mother that actually fed us well, and we were athletic and all that good stuff. But that's not the same for everyone. All right. So the goal is to encourage everyone to actually take advantage of the opportunities that are right there in front of you with the great healthcare system that you have here, the community resources that you have here as well, that we have here, I will say, to take advantage of those things. And something to keep in mind as we continue to walk down this road of wellness, keep in mind that change is normal. Without change, you know, we'll sit here and we'll struggle oftentimes, but change is normal. Change is normal for your health. You know, you gotta do what you can to make sure that's positive change, all right? So I'll move on to the next pieces of this. So looking at the numbers a little bit, men die at higher rates for 9 of the top 10 causes of death. This includes cancer, diabetes, suicide, accidents, and also disease of the heart and kidney and liver. Most of us probably know someone who is either experiencing this now, one of these conditions, or might have passed away of one of these conditions. That itself should move you into action. So everything I'm going to talk about today is in hope that you move yourself into some level of action. Don't just listen to the words, the things that I'm saying. Try to remember what I'm saying, so that way you can move yourself into some level of action and doing something about your health and wellness. If it's not you, then somebody that's around you. Maybe it's a friend, family member, son, whoever it may be, but you move them into action as well, okay? Now, one of the things that I have on the next slide, we don't like to talk about as men, which is mental health piece, all right? It's something that has been oftentimes overlooked by us, but it's something that is a strong component of health and well-being. Without the mental health piece in check, oftentimes we fail at most things. We fail at marriage, we fail at jobs, we fail at just being a great person in the community when we don't have our mental health in check, okay? So when it comes to depression, more than 6 million males are affected by depression each year. Oftentimes it goes undiagnosed because we don't say anything about it. We're of the old school that, you know, we can take care of it ourselves. And if we say something about it, it'll make us look soft. We're not tough anymore, right? But that's not the case at all. You're a bigger man if you step up and you say something about mental health or depression. If you're not feeling yourself, if you need someone to speak with, step up and talk to somebody about that. We're reluctant to report about feeling sad or not being worthwhile or worthlessness. Those are things that we got to get used to having conversations with people about, okay? Anxiety, over 3 million males have a panic attack or some type of phobia on an ongoing basis. 3 million males. So just think about that. It's a lot of individuals that's not talking about it. Bipolar disorder, 2.3 million Americans are affected by bipolar disorder. An equal number of men and women suffer from this disorder on an ongoing basis. So we're not by ourselves when it comes to bipolar disorder. There are a lot of famous individuals that are affected by these conditions as well. So it's just not us. It's just not the normal people. It's those famous people who make a lot of money too as well that are affected by this. The next one, suicide. Something that has started to really hit us as males pretty hard. And something we really have to pay close attention to. You probably see oftentimes in news there are stories about individuals who have committed suicide because they just don't know which way to go. They feel like there's no way out. Main reason why is also because they haven't spoke with anybody. They haven't talked to a professional. They haven't talked to clergy. They haven't talked to a friend or a family member. They haven't spent the time, to invest in conversation with another individual. So, male suicides have been on the rise since 2000, as the notes say, making it the 7th leading cause of death among males. So more than 4 times as many men as women die from suicide on an ongoing basis. Risk factors, social isolation, substance abuse, unemployment is a big one when it comes to suicides, and also military-related trauma also. Now, you're gonna get uncomfortable with this, gentlemen, all right? But get comfortable with this. All right, so this is a health topic. Oftentimes we don't talk about sexual health though. So your overall health and well-being, is a reflection of your sex life. It really is, okay? So how you eat, exercise, going to see a doctor on a normal basis, the healthier you are, the better it will be, all right? I don't see any men like, I don't want to talk about that, so. But it's one of those conversations that, and this is why this slide is very short, so I can get away from it, because I know it's an uncomfortable subject for y'all. But you need to be comfortable feeling uncomfortable about this, and start having the conversation with your physicians about this. Okay, I'm not telling you to go around talking to your friends about it. It may not be something that you want to do, but have a conversation with your physicians about these things on here, like ED. It's caused by heart disease, diabetes, certain medications. Lifestyle, and other problems. High levels of stress can actually cause this, okay? 30 million American men experience this on a normal basis, okay? So if you are experiencing this, I'm not asking you to raise your hand. I'm just saying that you need to go talk to your physician and have a conversation about this, all right? I'll move on from this one. Get a doctor, all right? So it's as simple as that. Get a physician, have a doctor, so that way you can start building a relationship with your physician. Doesn't matter what your age is, no matter if you're young or if you consider yourself seasoned. Get a physician and start having that conversation. Socialization, so while we don't get a physician, socialization plays a major part in men's decisions to frequent their physician or don't frequent their physician. Big boys don't cry. That's another part of that too, as well, why we don't get a physician. Work obligations, I got too much to do, I can't go see a physician. You better go see them now before you're not able to work. Lack of health insurance, there's still ways for you to get a physician, okay? Talk to us at the hospital, we'll lead you to the correct path. Some men decide they'll wait as long as possible for visiting a doctor in hopes that the situation would actually get better and it improve. The biggest obstacle, just not making your health a priority overall. So your health is very important. If not to you, it's important to the person that's sitting beside you. It's important to your overall family members. So just keep that in mind. It is a priority overall, okay? So what can we do to improve our health overall? And this is a loaded question, but this is where you get the opportunity to tell me, how can you improve your health? And I'll wait. Eating healthy? Yes. Exercise, yes. I gave you one of them just a second ago.
Go see a doctor.
Go see a doctor. Yes, ma'am. Yes. What else?
But when you go to the doctor, you also need to be truthful.
That's true. Very good point. She said when you go to the doctor, you need to be truthful.
Yes.
It's you and the doctor. Okay, so you can have that truthful conversation with your doctor. There's no need of you hiding things and keeping things back. You got to tell them the complete truth. If something happened yesterday, if something happened last month, you got to be open about those things so he can know your whole health history. What else? Listen to your wife. I cannot disagree. It's very true. Very true. Yes, listen to your wife, or listen to those loved ones that are around you that's trying to encourage you to do the right thing. If you're not married, if you have children, whatever it may be, listen to those individuals that are really trying to encourage you. Okay, listen to your wife. That's right. All right. So here's some things for you. So give yourself a chance. Okay. So when we look at wellness and prevention, we look at it as in our minds as that first line of defense. Okay, this is the first thing that you can do before you get sick or before you start feeling a certain way. Start doing those preventative things right now. They're not that hard. They're really not. It takes some effort. Yes, it does. But they're not that hard. It's not that hard to get up and go for a 30-minute walk each day. You don't have 30 minutes, then break it up into 15 minutes. Two walks for 15 minutes, okay? It's not that hard to include more water in your diet. It really isn't. You just have to take some focused attempts to do it. Those who love challenges, challenge your friends or challenge those that are around you. Challenge your spouse to eating healthier or drinking more water. Or go and see the doctor, so those things are available to you. First thing on here, get your annual health exam. I talked about that a number of times already. Know your numbers, your PSA, cholesterol, glucose, and your blood pressure overall. Keep your own records. Don't rely on the healthcare system to tell you what your numbers are. You should know this stuff too as well. Even though we have the resources in place to be able to tell you that, you need to depend on your own numbers and do your own comparisons year after year to be able to see if your numbers are changing from one year to the next year. But that's going to be very important to you. Make prevention a priority. This should be one of the number one things to you. Make time to be healthy overall. Again, it doesn't take a whole lot. Ask questions when you go to the doctor. So also being truthful with the doctor, but ask questions. Ask as many questions as you want. You should not feel rushed at all. And if you do, make sure you tell that physician that you do feel rushed and you have more questions. That's your time that you have with your doctor. And so own that time that you have with your physician, okay? Start now. Don't wait at all. Don't say, hey, I'll get to it next year. Next year may look totally different for us. Look at 2 years ago, 3 years ago. It looks totally different now, right? So keep in mind, don't wait. Just don't put it off. It's too important. Your health is too important to you and to those individuals that are around you as well. Involve your family members in your health. If that is a spouse or if that's a sister, brother, whoever that you can trust and that you feel that you trust. Involve those individuals in your overall health. And also be a role model. If you don't want to just do it for yourself, be a role model for those individuals that are around you. Children, friends. If you're a mentor, be a role model for those individuals too. Be a role model for your spouse too. Oftentimes that's a partnership, that you're working on together. You don't want to let one person down if that person's doing the right thing and you're just not doing the right thing, okay? All right, so improve your food intake. I heard that back there just a second ago about diet. Yeah, very true. So we're looking at an estimated of 160 million Americans who are either obese or overweight, with nearly 3/4 of American men that are obese or overweight. Okay, so we gotta catch this right now. We gotta make some changes on this right now. And again, it doesn't take a whole lot. The only truly effective way to lose weight is to reduce the number of calories and also exercise. Every diet is going to come towards you. Every fad diet you're going to see pop up on your screen. If you're on the computer that says try this diet, you're going to see it in the magazine. Your friends are going to tell you about it, all that good stuff. Some diets work for a short period of time, but it's very, very difficult to sustain a diet plan, okay? Now, healthy eating is totally different. Healthy lifestyle is totally different. You can sustain that without any kind of cause to your body in a negative direction. So keep that in mind. Eat fruits, vegetables, whole grains, and fat-free or low-fat milk and milk products. Eat lean meats, poultry, fish, beans, eggs, and nuts. So start including that in your diet. Again, it does not matter how old you are or how young you are. Just start doing those things now. Limit the intake of saturated fats and all fats overall. You do have to have some fat in your diet, but start limiting those high fats, okay? Exercise and fitness, one of the single best things you can do for your health overall, not just for your physical, not for just what you see, but also strongly for the mental piece as well. Exercise really improves your memory, also your physical activity overall, okay? So before starting any exercise program, this is my disclaimer here. Make sure you talk to your physician first, just to make sure that there's no issues or issues that they need you to watch out for, okay? Start off easy. Again, you may only be able to do a little bit at a time, 5 minutes, 10 minutes, but that's okay. And then eventually you will pick it up, okay? So if you have never ran a 5K before in your life, do not go out tomorrow and try to do one, all right? If you have never ran a mile before in your life, don't go out tomorrow and try to do one, because all you're gonna do is hurt yourself, okay? It doesn't matter how you're telling yourself in your brain that you used to do it 10 years ago. That was 10 years ago, and that was 20 years ago. Start out slow, so that way you can still be around to reap the benefits of your exercise, okay? Exercise at least 2 times a week at the minimum, and then you will gradually increase that, but you give yourself a goal to start out with first, okay? And they got to be realistic goals overall. And don't just look at the traditional forms of exercise too. Most people think about, I got to go to the gym and get on the exercise machine and exercise. You don't have to do that. We have a lovely park system here. In all the different areas, we have a great park system. Okay, so take advantage of the parks. Walk outside. There are so many free activities that take place in the parks and in the open areas that are here. Grab a friend to go with you too, also. That also helps out when you're out there walking and doing exercises. Okay. Prostate cancer. So this is one I really want to hit on, and you'll probably hear more about this in a little bit. But prostate cancer is the most common cancer in American men. Early detection can save your life. So again, do not ignore anything different that's happening with your body. You got to pay attention to those things. And oftentimes, though, with prostate cancer, you don't get a sign, though. You don't get an early warning sign at all. But that's the reason why you should be having normal checkups with your doctor. So that way you can have those discussions with them. And then he can also, or she can advise you on what screenings and what time period you take these different screenings, okay? On here is talk to your doctor about when you should have a baseline screening. Based upon your health history, it may be earlier than some other individuals are told to have their screenings, but you need to pay attention to that. I know myself, I'm getting close to that age to have that prostate cancer screening. No, I'm not looking forward to it, but this is one of those things that, yes, I know that I need to have done, and it's one of those things I will have done as well. And also ask your healthcare provider for any kind of additional tips or strategies that you can do to try to prevent any kind of condition such as prostate cancer, okay? The next slide on here is our physician referral line, and understand this is not for me to give you a commercial about where to go for your health and all that good stuff, but I do want everyone in here to have a physician. That's the first place and the first base for you, is to have a physician. Establish that relationship. I've said that probably about 10 times already during this presentation, because that's how important it really is. So we have the number there. If you don't write it down right here, that's okay. You know how to contact Sherry. Everybody here knows how to contact Sherry. She'll be happy to give. She'll be happy to give the information to you and share the information with you. And if not, find my information as well, and I'd be happy to talk to you about finding a physician and lead you to the right direction. Okay. Any questions for me? It's just been a pleasure to stand up here in front of this group and talk to you about health and wellness and prevention, and also to encourage our men to make sure we're doing the correct and right thing along the way. And again, never think in your mind that I'm too old or is no other chance for me right now. Yes, it is. Let's just go ahead and do the right things right now, okay? Questions?
Have there been number changes and age changes in some of the things regarding men's health? I'm thinking I heard.
Not a whole lot. Really, most of it's going to depend on your health history. That's the biggest piece, is your health history. For example, if prostate cancer is highly prevalent in your family, then the physician may encourage prostate cancer screenings at an early age. So a lot of the baseline information out there is basically what that is: baseline information for individuals to take action and start taking action. But most of the time, what we encourage individuals to do is still have that strong conversation with their physician to get that guidance.
There wasn't an age that they recommended?
For PSA? Yeah, 50.
Oh, it hasn't changed?
No, it's still 50. Some will tell you 45. Yeah, some will tell you 45. And so it bounces between those. But again, that's why I said strongly encouraged to have that conversation with your physician first. Yeah. Yes, sir.
I don't know if anybody knows this, but they probably do, but years ago, a friend of mine told me, he said, when you get a doctor, get an internal medicine doctor, because you're getting 2 doctors in one. You're getting a family practice doctor, and you get the doctor that knows all about diseases.
Mm-hmm.
So that's what I've always dealt with as
Right.
an internal medicine doctor. I've been very successful with all the internal medicine doctors I've had.
Yeah. Now, I'm not going to disagree with that or say, no, don't do that, or yes, do that. My goal is for you to get a doctor. That's that. So if you have an internal medicine doctor, I think that's great. Continue on that path. Any kind of encouragement that you want to give to any other gentlemen in here or ladies in here for that path, please do so. But I think it's just get a doctor first, and they'll lead you in the right way. Yes, ma'am.
I don't know where I heard this, but I heard that if a female, like there's 6 of us, if one of us girls had got breast cancer and you have brothers, they should be checked for prostate cancer because
there's a lot of information that's being studied about that. And so we're not at a place where we could say, yes, go do that, or no, don't do that. I think guys anyway need to get prostate checked at that age, that correct age. So it's just going to depend on what the course of action that the physician says. At the same time period, while I'm saying it's based upon the course of action that the physician guides you in, it's also based upon the individual male as well to also take action upon that. So if you know you have a family history of cancer, and you start having those conversations and being open and truthful with your physician, as it was said up here earlier. Okay. Yes, ma'am.
Between women and men, is there any food that's really bad for us? Really, really? Well, I notice this a lot, but is there one you say, just don't limit it?
I'm not gonna say it's a certain food like that. A lot of the like your trans fats, foods that are heavy in trans fats, yes, you do want to watch out for, because eventually what could happen is it can start clogging up your system and clogging up your heart, clogging up your arteries. So not one food, everything in moderation. You know, so people like to eat double meat cheeseburgers, triple meat cheeseburgers, all that stuff, you know, but the thing is, if you're gonna do it in moderation. It shouldn't be something that you should do every single day or every single week. You know, we all like to splurge sometime on special foods that are for us. I mean, apparently I got something planned for Father's Day, I guess, at my house. So that's what the ladies are telling me. So I guess they got a special cake or something that they're making. But, you know, and I plan on eating it. So, so the thing is, you know, it's in moderation, right? I don't do it every day.
So salt is really not good for the high blood pressure.
Salt is not, right, but in moderation, again, right? So, no, you don't want to eat and consume the serving that's on the side of the package. You know, if you have sodium issues overall, you know, and again, that's something that a physician or a dietitian can definitely guide individuals on as well. But also do your own research at those credible sites like the CDC and you know, those type of sites. Yeah. Anything else?
Chemicals that the farmers put in for the crop, do they cause cancer, a lot of cancer too?
Well, it depends. It all depends on the studies that you're reading, right? Some are going to say yes, and some are going to say no. You know, the thing is, I encourage people to try to eat as organic as possible. That's, to me, that's the more healthier option. If you can find foods that are organic at the farmers market that's here, we have a lot of organic farmers that are there, and you know, that's what they're giving out, and that's what they're selling. So. That's my encouragement, is to try to find the most organic foods that you can.
So I know when I was in Europe, the farmers over here use that, you know, called honey wagon.
Mm-hmm.
A lot of people probably don't know what it is.
Mm-hmm.
Yeah. Bobby knows.
Emptying of a septic system.
Yeah. Human waste.
That's interesting.
I know some other people use that though too.
Yeah, yeah,
And that,
yeah. Now,
that cause as far as cancer or your body's not functioning right, you know, eating that, all that material.
right. Do your research. I mean, I would say again, people need to do research too as well, and also have those conversations with like those dietitians and those nutritionists and those individuals that are in this field who specialize in this field as well. You know, I'm not going to tell people not to eat certain fruits and vegetables that are out there from certain forms or certain this, certain that. You know, you got to do some research there too, but from credible resources as well. Okay. Well, thank you again. I'm done with my portion of this. But we do have some wonderful people here that are going to talk to you a little bit about, I believe, their experiences. And Sherry, I'll hand it back over to you. Thank you.
Thank you.
Actually, there was no format. Since we were a heavy female-oriented and we were having a men's health day, sadly, these people I have to work with a lot. And I didn't get, they were outside of Reid, but I also know they had some different challenges with health. So we said, okay, we'll just have a men's health panel. Very informal. I know the mayor become very runner that improved his health. Eric has had bouts of prostate cancer. And Mark and his wife have been on a journey from infertility, we're happy to say. They're having a baby soon. And Doug and we have a joke that I probably see Doug more than I see my husband, because Doug and I are on a lot of the same committees. So I can always depend on Doug. And Doug has had some challenges and some substance misuse, and has been a wonderful speaker on sharing his journey. So
Good job.
I'm going to let the mayor talk first.
Okay, sure. Thank you, Sherry. So, yeah, going back to the early 2000s, I was, I was weighing about 230 pounds back then. So I really had to turn myself around and make some better health choices. So coming from the men's perspective, I want to hit a couple of points. I made some notes, and a big thanks to Tajuan for all of his knowledge and his great presentation. I would say a challenge for men, the number one challenge for men is eating and socializing for men is just different. When you go to somebody's house for a cookout or a dinner and somebody says, hey, can I get you a cheeseburger and a beer? A guy's supposed to say yes. You're not supposed to say, oh no, I'm watching my figure, I'm gonna have a salad. It's hard for guys to say that. But you know, when you're in your mid 40s or 50s or 60s, the last thing you need is a cheeseburger and a beer. So Tajuan said everything in moderation, and if that's the way you're gonna do it, and you sort of save up the whole week, you eat really healthy because you say Saturday we're going to that graduation or that wedding reception, and I know that I'm gonna get hit socially, that's where the people close to you come in handy. So you say, you kind of help me get through this week and let's eat really healthy because I know Saturday I'm going to be hit with the social situation and I got to eat that food because it's just hard for a guy to do that. Also, when you set goals, this is really important to me, just don't worry about the scale. I think the scale is the worst thing. I bet nobody in here knows what I weigh today. If you had, go ahead and guess my weight and I'm going to tell you it's 180. People typically think I weigh like 140 or 150. So nobody knows what you weigh and it doesn't matter. So instead, have a goal of something you want to do. It could be anything. Maybe it's a vacation that you want to take. Maybe it's taking grandkids or kids out to a play date in the park. Maybe it is a 5K. Whatever it is, set that kind of goal and then stick to that so that when you do that thing, you know that you kept yourself healthy enough to do it. And then lastly, keeping track of the cumulative effects of food. That's one of the most important things that I've done to get my health straight. So, you know, Tajuan will tell you some of those things you got to watch out for. We talked about salt and sugar. Sugar is one of those terrible things, and we all know that. But here's where you get tricked. Let's say you sit down, we talked about going to that cookout or that graduation, and you think, I'm going to skip dessert today because I'm trying to watch my sugar. So you get that hamburger, and it's got that hamburger bun. That bun has high fructose corn syrup in it. You get baked beans, it has brown sugar in them. You got ketchup on the burger, it's got sugar in it. You've got your drink sitting there, it's got sugar in it. You never had dessert, but you ate more sugar than you should have eaten for the whole day, and burger and baked beans and a drink. So that's the thing to watch, and just kind of be cognizant of it. So at least for guys in that social setting, you can skip some of those, you know, get the burger and the beer because you don't want to say I'm having a salad, but skip the ketchup, skip the baked beans, skip the sugary drink. And that way you can take down the cumulative effects of that food hitting you all throughout the day. So that's just some of the advice I would share, but I'll pass it over to Eric.
I weigh less than the mayor. I'm happy about that. I've made my goal. One of the things that I will say, and Sherry is correct, I actually just this past April hit my 10-year anniversary for my bout with prostate cancer. One of the things that triggered that, and Tajuan mentioned the encouragement of family and knowing maybe you need to have something checked earlier. One of my older brothers ended up with prostate cancer, which made me go to the doctor a little bit earlier than I normally would have to get that checked. So my baseline, by the time I hit, when we saw that spike, we knew it was a spike because I had been checking out for a number of years. I will also say that I'm from a family of 5 boys, and 4 of us have been stricken with this. So knowing that family history, again, is also something that you want to make sure that you're aware of. And before I pass it on, because I know we're coming up on time, the only other thing that I would say, and again, Tajuan mentioned working with your wife or listening to your wife. A number of years ago, my wife and I went and found a GP together. When we do our annual checkups, we schedule our appointments one right behind the other. So we are able to go to our appointments together. We stay in the room with each other. I hear what the doctor says about her, she hears what the doctor says about me, and that way it's not a matter of me forgetting to tell her something or me not telling the doctor something. The lady said, be truthful. You know, we always kind of go, well, yeah, it hurts a little bit. No, it hurts a lot. Whenever he moves that arm. So having that partner with you is another possible solution to being truthful and knowing what's going on.
I would have to say I do not weigh less than the mayor.
It's a round table contest.
I did. Safe to say I weigh the most at this table. Being the youngest in the room, minus maybe 2 people, my perspective is kind of like old school. So my dad had prostate cancer when I was in middle school, and I thought he was going to die. And then I was like, I've seen it in a movie. This is what happens. You get cancer and you die. But what happened was he actually went to the doctor early on. So that's the same thing that I do. And so far so good, but be following the same path. So I catch anything early. I wrote a couple things down driving home from Tennessee yesterday, thinking about this. So my story started about 5 years ago. My wife and I got married and we were going to start a family. And then 2 years went by and we still were not pregnant. So we're like, oh my gosh, this is not like a love story. This is starting to become horrible. So we ended up becoming pregnant, and lo and behold, 1 in 4 has a miscarriage. So we're like, okay, we're just 1 in 4. That means the next 3 will be us. So 4 miscarriages later, I had genetic testing. She had genetic testing. We've had all of our life looked at. So this August we will be delivering, but that's not really why I brought that up. I was a person that battled depression and anxiety. I've had a mental breakdown on the interstate that goes around Louisville because a song came on, and next thing I knew, I was like, oh my gosh, that's my life. Like, what is going on? So again, I did something for the first time in my marriage. I listened to my wife, and she's like, you've got to go to the doctor. I'm like, I'm a guy, it's fine, I'll brush this off. So I went to the doctor, and he said, you were severely depressed. I didn't know about it. It happened slowly. So if you're a guy, it's okay to go to a counselor. I still go every once in a while. I would say once a year at least, just to go. Sometimes they're good. Sometimes he's like, hey, come back in a few months, which is completely fine. But it's okay. And then no matter what, just think about, you're a guy. So you smoke meat or grill, and you wait for a pork butt or brisket to be done. You're going to wait like 12 hours to get that done. It takes less time to save your life by going to the doctor than it does to make dinner. I was like, wow. Thank goodness I came to see you today, doctor, because I actually need to go home to finish my dinner. But in all reality, it is just important to go and be honest and truthful, because that's going to be the difference in changing your life and the way you are.
Thanks, Mark. Not sure how I follow that one, but I'll do my best to. For starters, I want to thank Sherry for inviting me here to participate today. And coming in, I really didn't know which slide I would really apply to when I was thinking, how can I share something that may benefit the room? And kind of what Mark hit on a bit, the one that really resonated with me was the mental health slide. I wish we would have asked Tajuan to leave that one up, because I could have checked many of those boxes on there. As Sherry stated, one of the things that I struggled with in my past was my substance abuse, misuse, whichever way we want to look at it. I'm a recovering alcoholic, addict. But peeling the layers back, mental health. I mean, that's peeling, take the alcohol and the drugs away. It was the mental health behind that. And I think that's one of the many uncomfortable words that us as people, and especially as men, like to talk about. We don't want to talk about our mental health or our anxiety or our depression or what other words might be behind that, but that was always the case for me. And now I realize how much I have to protect my mental health now. Because now I have to really watch out for my anxiety or my depression. And I always used to, one of the things that I really look for now is in the wintertime. I hate cold weather. So I am perfectly happy staying inside by myself and sitting in my recliner and watching Netflix all winter long. But now I realize how dangerous that is for my mental health. And my mental health is connected to my physical health. And this and that. And the one thing that I guess I'll leave with, because it is time, and I want to respect that, is the one thing that stuck out on Tajuan's slide is the main reason I need to do that now, because I was okay before. When I got depressed and I was drinking and drugging, I was okay if I would have been one of those suicide statistics. I was just too chicken to take myself out of the game. But what I realize now is how selfish that would have been and would be for me to go back down that path. I need to be a good role model for my nieces and my nephews and the children in our community. I think they all deserve us to do more and take more action and to be better. So, thank you.
We want to thank everybody for coming, especially Tajuan. Thank you. And to the men on the panel, thank you very much.